Heather from One-to-One Physical Therapy. Myself and my colleagues, Noelle and Corey, are specialists in posture and breathing through the Postural Restoration Institute. We created this video and accompanying blog article to teach you what we consider to be one of the most important things you can do right now to help prevent and manage the breathing and respiratory issues related to COVID-19. As many of you know, COVID-19 primarily infects the lungs, and if it progresses far enough, it can result in pneumonia, where there is increased fluid and scar tissue. This reduces our ability to obtain oxygen and ultimately breathe. According to one source that we found, it appears that this pattern can be present in the lungs even before symptoms appear. This edema and fluid are a result of the body's immune system trying to fight off the virus. However, problems can arise when the debris created from the immune response is not being cleared out effectively and efficiently. This is what causes the congestion and fibrosis in the lung tissue. When dealing with an infection in the lungs, we not only need to have a strong enough immune response to kill the virus, but we also need to be able to clear away the debris. This occurs primarily through our lymphatic system. We have lymphatic channels and nodes throughout our lungs to filter and clear away the waste created by an immune response. And just like our heart powers our circulatory system, our lymphatic system also requires a power generator. This power generator is our breathing and our movement.
As Heather just explained, in order to power your lymphatic system pump to keep your lungs clear, you need to optimize your breathing and movement. Did you know that most likely your baseline breathing is not sufficient to accomplish this? This is especially true if you're under any stress, have asthma, allergies, or any other baseline respiratory condition. We find that the majority of our patients are breathing very shallow, when in fact our breathing needs to fully contract and fully relax in order to be an efficient pump. When we breathe too shallow, our diaphragm becomes too tight. In order to relax the diaphragm, you must first learn how to exhale completely. After a complete exhale, you can then inhale. These excursions of inhales and exhales create the pressure differentials needed in the lungs for efficient lymphatic drainage and clearance of respiratory debris. The other driver of lymphatic flow is our three-dimensional movement that should normally occur throughout our pelvis and our rib cage during breathing and walking. This also serves to pump our lymphatic system. Next, we're going to show you how you can perform this full excursion of breathing while incorporating three-dimensional movement in order to optimize your lymphatic pump.
So, we have selected this breathing exercise in order to optimize our 3D ribcage movement for lymphatic flow and lung health. To perform this exercise, you come into a seated position. We are using a stool here. You can use a stair at home or even perform this in a chair. The lower the better, so try to challenge yourself. We are going to link breathing with arm movement here. So just like walking, you're going to bring one arm out in front and one arm back behind your body. As you inhale, Noelle is going to reach her arm back behind her, expanding the front of her right chest. On inhale, on her exhale through pursed lips, she is going to reach her left arm forward, engaging her abs. She's going to stay in this position. Try to pause for 2 to 3 seconds before inhaling through your nose, expanding your rib cage, reaching behind you, exhaling, reaching forward, and blowing through pursed lips. One of the most important things that we can do here is add low vowel toning during our exhale. This really stimulates lung movement and lymphatic flow. So low toning on exhale. And the amount of air that you have inside you might surprise you. So continue to exhale. And remember to pause for 3 seconds afterwards before your next inhale. A few mistakes that typically happen here are overuse of the neck during inhale, as well as lifting up during inhale. Noelle does a really great job here that she is expanding on inhale, not lifting up or overusing her neck. And exhaling, reaching forward. Perform this 4 to 5 times on one side and then switch and do the same thing on the other side.
Thank you for watching our video. We hope you found this information helpful for your health. Please give it a try and let us know how you do.